Hi, Dr. Joe here to talk a little bit about a new problem, I think a new epidemic. It's the obesity that's occurring with antidepressants and antipsychotic drugs. We have used some of the older drugs to actually induce weight loss. Not everything does that well, but we've done well with some of them. But now we have everybody being more and more labeled bipolar, and therefore eligible for a lot of the new medications that are used. So we have now seen so many people come in with the metabolic syndrome. This is now called the cardiometabolic syndrome. And what it says is that you're on your way to getting diabetes, heart disease, perhaps even Alzheimer's. Those are not tidy things to live with. And initially what you feel is a great increase in abdominal fat and an unusual fatigue that comes also with this sort of situation. We have a series of new things that are now coming out in the psychiatric literature to talk about this. These are major drugs that are used today, and just to talk about a little of them, clozapine, if I've got that right, and olanzapine are two of the ones that have a lot of things associated with it. And there are old medications as well as Thorazine and a variety of things which we have known in the past are associated with weight gain. We didn't realize the very close connection and the fact that it's actually triggering the metabolic syndrome. So if you get off it, it does not go away. You have to do something very active to get rid of the whole thing. Most of what I've seen confirmed and what I have seen in patients are in the Acta Psychiatric Scandinavia 2009, March 1st. They're ahead of time, aren't they? But this is a major journal and it does a lot of things. This medication review is actually from Southern California in San Diego. But among these drugs, there seems to be something we've not recognized before, and it's worse. The new drugs are the worst drugs, and we see it occurring in all kinds of things. So what do? We treat them as if they have diabetes too. The metabolic syndrome has been known to respond to this, and we've done a huge amount of people, and what we are able to do is to control it. We would like to get people off these medications because they are powerful. Not only what they do for your psychiatric health, but what they do for the rest of your health, which is not good. This is what we'd like to do, and we do it as much as possible, working with the psychiatrist and any other health professional who feels this is needed. We found scattered about the literature in small cases a lot of information that successfully says if you use vitamin D in generous amounts, that's to be determined for everybody. If you use it in generous amounts, there is a lack of the consistency of depression that needs to have lots of drugs virtually forever. So I think we have to think anew on this. This is not good for everybody. And if you really get this tremendous abdominal fat that goes with it, you'll really realize that